Hi everyone, good day. This is Dr. Von, and for this week, we will be discussing the last topic for your endocrine system. So ito na yung pinaka-huling discussion natin for the endocrine system. But this is gonna be a combination of the different organ system. So we will be discussing your male and female gonads and other miscellaneous endocrine glands such as your placenta, kidneys, and GI tract. I know it's a lot, but my main discussion will focus more onto your male and your female gonads. And for the other organ systems, such as your placenta, kidneys, and GI, we'll just run down those important hormones and we will identify each of these functions. So for our learning objectives, at the end of this video lecture, the student will be able to review again the anatomy of your male and female gonads, your placenta, your kidney, and your GI organs. Then we will try to describe the functions of these organs and the hormones they secreted. Then we will discuss again the most important one, the HPO axis, your hypothalamic pituitary endocrine target gland loops. Kasi nga, kahit gaano pa kahirap yung question or problem, basta alam natin yung hypothalamic pituitary endocrine target organ, we will be able to answer different problems. Then we will discuss how to regulate these hormones and then the different clinical features of the different disorders of these organs. We will relate now the physiologic underlying, the strategies used for screening and definitive testing for these suspected disorders. So I hope na meron tayong mga cases na pwedeng ma-correlate sa ating mga disorders. So we will start with your female gonads. Sa lahat-lahat, ito talaga pinaka-ayaw kong i-discuss because of your menstrual cycle. Kasi ang menstrual cycle is very complicated. You have to correlate it with your uterine cycle. Anong nangyayari sa uterus? Kasi simultaneously nangyayari yung uterine cycle sa ating ovarian cycle. So meron din tayong ovarian cycle. Tapos i-correlate mo pa yan sa anong nangyayari sa ating hormones? Yung FSH, LH, may correlation yan sa ovarian, sa menstrual cycle. It's quite complicated and you know what? Sa lahat ng mga na-discuss ko, so far yung female gonads talaga yung nireview ko ulit, yung menstrual cycle, nireview ko ulit. And I try my best to simplify your menstrual cycle kasi nga, ito yung pinaka-importante na dapat nyong malaman. Kasi, promise guys, complicated siya for me. I don't know. Pero, I tried my best na i-simplify para magets natin yung menstrual cycle, okay? So let's proceed first with the anatomy and histology of our female gonads. Again, as a review, this is in sagittal view or lateral view. Ito yung uterus, right? This is the uterus. Remember, this is your vaginal orifice. This is your vaginal canal. This is your cervix. And this is your uterus. Lateral view ito, guys, ha? So anteriorly, anong boundary ng ating uterus? Anteriorly, ang nasa harap ng ating uterus is your urinary bladder. Kasi nga ito yung urinary bladder, lalabas, ito yung urethral orifice. Ano namang nasa likod ng ating uterus? It's your rectum. So this is the anatomic relationship of your uterus to the other organs. And then, katabi ng ating uterus, we have your ovaries, including your fallopian tube. Now, the ovaries, the female gonads or sex gland, they develop and expel an ovum or egg cell each month. A woman is born with approximately 2 to 4 million immature eggs called your follicles, specifically your primordial follicles. In a lifetime, we have approximately about 400 to 500 fully matured eggs for fertilization. So the follicles in the ovaries produces the female sex hormones, your progesterone and your estrogen. Maturation of your follicles is blocked until puberty. In short, your follicles is still immature until dumating na sa puberty age, nagmamature ng ating follicle. Kaya nga, until puberty, nagkakaroon na tayo ng menstruation. These hormones prepare the uterus for implantation of your fertilized egg. And then it's about 2 to 5 centimeter in length and 14 grams in weight. So let's review your hormone sexual development and function of your ovaries. So your hypothalamus, again, remember your hypothalamus will release your gonadotropin releasing hormone. the gonadotropin-releasing hormone will stimulate your pituitary gland to release the gonadotropins. Ano yung gonadotropins na yun? Your follicle-stimulating hormone and your luteinizing hormone. Your follicle-stimulating hormone and your luteinizing hormone, the ovaries will stimulate your ovaries to release estrogen and progesterone. So your FSH and LH to release your estrogen and progesterone from your ovaries in general. Then, the maturation of your reproductive organs, there will be breast development, increased deposit of fatty tissues. Tandaan nyo ha, ang importante ng estrogen, breast development, and increased deposit of fatty tissue. Your progesterone is basic for reconstruction and maintenance of your endometrium, preparation of your endometrium for implantation, and continuation of your pregnancy during early months. Remember, overview, estrogen, kailangan si estrogen para sa breast development at siya din yung kailangan para mag-thicken ang ating uterus. Siya yung ginagamit para mag-proliferate or mag-thicken ang ating uterus. Samantala, si progesterone ay kailangan para ma-maintain yung pagiging makapal niya. Tapos, siya rin yung mag-prepare ng ating endometrium for implantation. And that's gonna be your progesterone. So, remember that basic function kasi nga, magagamit natin yan later on. So, your adrenal glands and ovaries can also release androgen. And these can development for the body hair patterns, female sex, skeletal growth, and female sex drive. Estrogen, progesterone, and some androgens. So, these are transported by your sex hormone binding globulin, and your progesterone is transported by your CBG. 1 to 2% are actually in your free form. Majority is attached to your transporter protein. So let's discuss each of these hormones. Your estrogen, it's a carbon-18 compounds. The principal estrogen is your estradiol, diol, kaya E2. Primary metabolites, estrone, E1 during your menopause, and your estriol, E3 during pregnancy. Again, during reproductive age ng babae, ang predominant na estrogen is your estradiol. During menopause, ang predominant na estrogen form is your estrone. During pregnancy, ang predominant na estrogen is your estriol. So, meron kaming mnemonics dito sa medicine para hindi namin to makalimutan. Unang-una, estradiol or E2. Dalawa, estradiol E2, reproductive age. Meaning, meron kang asawa. So, lalaki, babae, mag-asawa. So, that's estradiol E2. Pag nabuntis ang babae sa lalaki, nagiging E3, that's pregnancy, nagiging tatlo na sila. Babae, lalaki, at saka yung anak. Pero during menopausal age, namatay yung lalaki, namatay yung bata, mag-isa na lang siya sa buhay, E1 estrone. Okay, don't forget that. E1, menopause, E3, pregnancy, estradiol during reproductive age. Again, estrogen, promote breast development. Tandaan na, promote breast development. Ito yung gusto kong matandaan yung promote breast development, uterine and vaginal development. It also affects your vascular smooth muscle vasodilation. Your estriol is during pregnancy, causes utero-placental blood flow. It increases also your vaginal lubrication and inhibits bone resorption. That's why during menopausal age, yung babae nagkakaroon ng osteoporosis kasi nga ang estrogen is essential for inhibiting your bone resorption. So for those who undergo menopausal stage na, we give your estrogen pills. Next, your estrogen is also essential for ovulation kasi nga because of a surge in estrogen level, it induces the release of your luteinizing hormone. Again, pag mataas, sobrang taas ng estrogen level, tataas din yung luteinizing hormone which will triggers your ovulation by releasing the egg cell from your Graafian follicle in the ovary. Later on, you will see a diagram. We have your cardioprotective, increases your HDL level, decreases LDL, and decreases your platelet addition. So, patient on a menopausal stage, nagkakaroon ng pagbaba ng HDL at pagtaas ng LDL kasi nga nababawasan ang estrogen or bumababa ang estrogen level. Pero during a reproductive age, mayroong tayong tinatawag na cardioprotective effect ng estrogen kasi nga pinapataas niya ang good cholesterol, binababa ang bad cholesterol. At binababa din yung platelet adhesion so that there will be no thrombosis sa ating coronary arteries. Estrogen is also important for the fluid balance, salt, and water retention. So there is a two-cell theory of your estrogen production. So your luteinizing hormone stimulates the production of your androgen or your androstenedione from your cholesterol in the fecal cell. So tingnan natin, your luteinizing hormone will stimulate your fecal cells so that it will convert your cholesterol into an androgen. Then this androgen is transported to the granulosa cell where it is converted into estrogen. Again, from your fecal cell, your LH will stimulate your fecal cell to convert cholesterol into androgen. And then this androgen will go to your granulosa cell with the stimulation of your follicle-stimulating hormone, converts your androgen into your estrogen with the action of your aromatase. So your FSH promotes the conversion of your estrone to your androgen into your estradiol in the ovaries. So this is how your estrogen or your estradiol is being converted. Now let's proceed with your progesterone. Your progesterone is a carbon-21 compound. It is produced by your corpus luteum. So tandaan lang natin later on, mayroon tayong diagram, corpus luteum, during your secretory phase ng ating ovarian cycle. It reduces the uterine contractions, increased cervical mucus, and allows sperm to survive, and for the reconstruction and maintenance of your endometrium. Ito lang gusto kong tandaan nyo. Ang estrogen for breast development. Tapos, siya yung nagpapaproliferate or nagpapakapal ng ating uterus. Ang progesterone is for the maintenance of endometrium. Siya yung nagme-maintain ng lining ng ating uterus. So, yan yung dapat nyong tandaan, guys, ha? Remember that. So, progesterone, reconstruction, and maintenance of your endometrium. And it also have a thermogenic effects. Wait, nalipong ako. Wait lang. So for the regulation of your hormones, so again, let's repeat. Controlled by your hypothalamus. Once your hypothalamus is being stimulated, it will release your gonadotropin-releasing hormone that will stimulate your anterior pituitary gland. Your anterior pituitary gland will release your follicle-stimulating hormone and your luteinizing hormone. Remember, your follicle-stimulating hormone will go to the ovary. Follicle-stimulating hormone will stimulate the follicle to grow. From the name itself, follicle-stimulating hormone. It will stimulate your follicle to grow. Stimulate your follicle to grow. And with that, the growing follicle of your ovaries, the growing follicle will produce the estrogen. Estrogen secreted by the growing follicle. So in short, your FSH will stimulate your growing follicle so that it will produce your estrogen. Paano naman po yung luteinizing hormone? Yung luteinizing hormone, with the stimulation of increased estrogen, there will be a peak of your luteinizing hormone. Tataas ang LH, causing now ovulation. So tingnan nyo, because of an LH peak, it triggers your ovulation. Later on, we will discuss this thoroughly in details. Pero ito lang is just an overview of the regulation of your hormone. So ngayon, marami na tayong estrogen. Tapos may ovulation na. Anong nangyayari? Tanda, di ba? Remember, your corpus luteum will cause the production of your progesterone and estrogen secreted by the remnant follicle. So it is your corpus luteum that will produce your progesterone and some of your estrogen. So mataas ng ating estrogen, mataas ng ating progesterone. So anong nangyayari? Negative feedback mechanism. So sobrang taas ng ng ating gonadal hormone, magkakaroon na ng negative feedback mechanism. Bumabalik tayo sa hypothalamus, inhibited by the combination of estrogen and progesterone. Kasi nga, masyadong mataas ang ating estrogen and progesterone, na-inhibit ang ating hypothalamus. Later on, makikita din natin na nasti-stimulate ang ating hypothalamus, stimulated by high levels of estrogen. Di ba? Weird, kasi nga mataas ang ating estrogen, Doc. Bakit nasti-stimulate yung ating hypothalamus? Later on, we will discuss that sa ating ovarian cycle. But with that, kasi nga, an increase in your estrogen will cause a stimulation of your luteinizing hormone. So, pag nasi-stimulate sa ating luteinizing hormone, it will send signals to your hypothalamus to increase your GnRH, to increase the level of your LH. Later on, we will discuss na, I know, nako-confuse pa kayo, bakit diba Doc, bakit mataas ang estrogen pero stimulate ang ating anterior pituitary or hypothalamus? We will discuss that later on. Ito, review lang natin. Hypothalamus, GnRH, stimulate anterior to secrete FSH and LH. FSH will stimulate the follicle from the name itself, follicle stimulating hormone. The growing follicle will secrete estrogen. Increased estrogen during your mid-cycle stimulate your luteinizing hormone secretion. Pinapataas niya yung luteinizing hormone, thereby stimulate your anterior pituitary to increase the secretion of your LH. Kasi ang trabaho ng LH, it causes now your ovulation. What else? Your LH could also stimulate your ovary by the production of your corpus luteum to produce your progesterone and some of your estrogen. And then it will increase your progesterone, your estrogen. After ovulation, it will now cause inhibition of your FSH and LH. Kasi nga, sobrang dami na naproduce ng progesterone and your estrogen. Anong nangyayari? Ini-inhibit niyo na yung anterior pituitary and your hypothalamus. Isa lang yung confusing dito guys, an increase in estrogen. Pero tandaan ha, an increase in estrogen during mid-cycle cause a positive feedback mechanism to your anterior pituitary gland to release your LH so that there will be LH surge. And this LH surge will cause now your ovulation. Pero after ovulation, pag mataas ng estrogen, nagka-cause na siya ng inhibition sa ating hypothalamus and your anterior pituitary. Ito lang yung gusto kong malaman nyo. An increase in estrogen during mid-cycle, stimulation. An increase of your estrogen and progesterone after ovulation, inhibition. Remember that. Note, estrogen level peak 1 day before ovulation, there will be LH surge. Excretion of the ovum takes place 36 hours after LH peak. Implantation of your egg takes place 9 days after ovulation. Meron tayong tinatawag na telarch. So telarch, this is actually your breast budding and this is the first sign of puberty in females. While your menarche occurs 2 to 3 years after your telarch. So, if at age of 10, mayroon ka ng telarch, so we will expect na you will have your menarche or your first menstruation after 2 to 3 years. But if you have telarch but will no menarche, then that's gonna be a problem. There could be a primary amenorrhea or certain disorder in the patient's body. Now, let's proceed with your ovarian cycle. Ito na yung ovarian cycle. I-discuss muna natin yung ovarian kasi nga yung menstrual cycle is a combination of your ovarian cycle and your endometrial cycle. Tapos may combination pa yan ng mga hormones coming from your pituitary gland and your hypothalamus. So simultaneously yang nangyayari. Pero ngayon, I want you to focus first on the ovarian cycle. Tingnan lang natin. This is your ovarian cycle. So just a general view, Ito yung ovaries natin. So your primary follicle, meron tayong mga follicles sa ating ovary. So your primary follicle will be converted to secondary follicle, then magiging tertiary follicle or magiging vesicular follicle until such time na magkakaroon ng ovulation. Pag nagkaroon ng ovulation, malalabas yung ating egg cell. Tapos, ang natira sa ating follicle nagiging corpus luteum. Tapos, yung corpus luteum nagdegenerate tapos namamatay. And till such time, bumabalik na naman tayo sa pag-stimulate ng ating follicle. So, that's the general overview. Tingnan natin. Your ovarian cycle. Your ovarian cycle, these are the phases of your ovarian cycle. Meron tayong follicular phase, ovulation phase, and luteal phase. Unahin natin ang follicular phase, guys. Tapos, ovulation, then luteal phase. Ito yung the entire ovarian cycle. Primordial, nagiging primary, nagiging secondary, nagiging tertiary, then nagiging Graafian follicle, until such time na dumating sa ovulation, and then yung follicle, nagiging corpus luteum and your corpus albicans. For the follicular phase, ito yung unang nangyayari from primordial hanggang Graafian. That's your follicular phase. Ovulation phase, that's your ovulation phase. Luteal phase, that's from your corpus luteum to corpus albicans. So first, let's talk about your follicular phase. From the name itself, follicle, follicular phase. So ang bida dyan is your follicles. So your ovarian cycle, follicular phase, your follicular phase happens day 1 or day 0. Again, this is wrong. Check ko lang. This is, sorry. This is day 0 to day 14. So follicular phase, day 0 to day 14. Remember that? Folliculogenesis. Kasi nga, we need to form your follicles. One follicle will be equivalent to one oocyte. So, first, primordial follicle. Your primordial follicle, your oocyte, is surrounded with your squamous pregranulosa cells. 90 to 95% of all follicles are actually primordial. So, gusto ko lang tandaan nyo, ito yung primordial follicle. Your primordial follicle is surrounded by your granulosa cells. These are your granulosa cells, which is actually a squamous cell. So, tingnan nyo lang. Yung granulosa cells, ang shape niya is squamous. So, that's a primordial follicle. Your primordial follicle will be converted into a primary follicle. Your oocyte now is surrounded by cuboidal granulosa. Simple lang. From a squamous, nagiging cuboidal. Now, that's your primary. Doc, anong nagsistimulate sa ating primordial para ma-form siya into primary? Remember, ano nga yung nagsistimulate sa ating follicular phase? It is your FSH. Your follicular follicle stimulating hormone will stimulate the follicles to mature. So, ito na yun. From an immature to mature, ifo-form na natin yan. So, from primordial to primary. Next, anong nangyayari? Secondary follicle. From primordial, nagiging primary, nagiging secondary by the action of your FSH. Secondary follicle, several layers of your granulosa. So, bali, nadagdagan lang ng layer ang ating granulosa cell. That's your secondary. How about tertiary po, Doc? Your tertiary follicle is the granulosa cells secrete fluid to create a space called antrum. Your tertiary, naglalabas lamang siya ng fluid. And this fluid creates a space called your antrum. Then there will be zona pellucida that surrounds your oocyte. So your follicles, guys, ang isang follicle natin, guys, sa loob niyan, mayroong oocyte. Ito yung lumalabas. Ito yung lumalabas during ovulation. Ito yung gusto nating maging mature na egg cell. Pero sa primordial follicle pa lang, nag-i-immature pa lang yung ating oocyte. Kaya nga, kailangan natin yung FSH para ma-stimulate ang ating follicles to become a mature follicle. Tapos, lalabas yung oocyte and magiging mature ovum. So again, review lang natin para matandaan. Primordial, gusto ko lang tandaan, just a simple squamous. Primary, cuboidal, simple layer of cuboidal cells. Secondary, nadagdagan ng layers ng ating granulosa cells, at saka tertiary, nagsisikret na ng fluid. So that's it. So secondary follicle, at its most mature stage that bulges from the surface of your ovary. So your secondary follicle is already a mature cell, but still, it will need to undergo a tertiary follicle. Anong next po dyan, Doc? Tertiary. From tertiary, nagiging Graafian follicle. Anong yung Graafian follicle, Doc? Nag-i-enlarge lang yung antrum. Kasi nga, di ba, nagsisikret ng fluid. Simple, nag-increase ang fluid, lalong lumalaki yung antrum na space. Tapos, meron ding formation of your cumulus oophorus. Yung cumulus oophorus, sinusurround yung ating oocyte. Kasi ito yung egg cell natin. Nagpo-form ng cumulus oophorus sa ating egg cell. What is the purpose of your cumulus oophorus? Your cumulus oophorus is helpful for the maturation of your oocyte. So, bali yung cumulus oophorus will help for the maturation of your oocyte. It also provides protection of your oocyte. So, that's the first phase of ovarian cycle. Day 0 to 14 yan, guys, ha? Day 0 to 14, your FSH will stimulate your follicle from the ovaries to mature. Tapos, pag nag-mature ang ating follicle, anong nangyayari? Because of a growing follicle, anong nangyayari? Nag-produce ng anong hormone? Estrogen. Remember that. Next phase. Now, next phase is your ovulation phase. From follicular phase, nagiging ovulation phase na. This is gonna be your day 14. Tatandaan natin, guys, sa ovulation phase, there is LH surge or LH peak. Tumataas ang ating LH surge. Release of your oocyte from the follicle. So, since sa follicular phase, gusto nating maging mature ang ating oocyte. Tingnan nyo, since naging mature na ang ating oocyte, there will be rupturing of your follicle. Lumalabas na yung mature oocyte. Tapos, ang naiiwan na lang is yung remnant ng ating follicle. So, there will be expelled oocyte is picked up by the membrane. So, pupunta siya sa membrane. Di ba? Nalabas na yung ating oocyte. It will be picked up by the membrane. And then, oocyte is transported to the ampulla. Tapos, pupunta siya dito sa ating ampulla where it awaits for fertilization. If fertilization happens, zygote resides in the ampulla for 72 hours, then floats into the uterus for 2 to 3 days before attaching to your endometrium. So your ovulation happens on day 14. From day 0 to 14, follicular phase. At day 14, ovulation phase happens wherein your oocyte, your follicle rupture and oocyte is being released. This is brought about by your LH surge. Again, ano ngang nagkukos ng LH surge? Because of increased level of your estrogen. Remember, there is a growing follicle. Once there's a growing follicle, or minamature natin ang growing follicle, nagre-release din tayo ng estrogen. At a high dose of estrogen, it will cause a stimulation of your LH or your anterior pituitary gland to release your LH. This is cause now your LH surge, and this LH surge cause now your ovulation. Is this a negative feedback or a positive feedback? This is a positive feedback. Natatandaan nyo yun na mayroong 2 or 3 mga events lang na nangyayari ng gumagamit ng positive feedback. Una, your oxytocin, positive feedback mechanism. And the second one is this one. Because of an increasing level of an estrogen, at a high dose of estrogen level, it will stimulate your LH. It will stimulate your anterior pituitary to produce more LH. And because of an LH surge, it will cause now your ovulation. I hope it's clear. Next. Doc, tapos na tayo sa follicular. Follicular phase, anong nangyayari? Review lang natin, ha. Follicular phase, day 1 to 14. Gusto nating mag-mature ang ating follicle habang nagmamature ang ating follicle, nagpo-produce ng estrogen. Tapos, because dumadami ang estrogen, nasi-stimulate ang ating anterior pituitary gland to produce more LH. Kaya nagkakaroon ng LH surge. Kasi may LH surge, nare-release, nagkakaroon ng ovulation. Since na-release ng ating oocyte, anong next phase? We will now enter your luteal phase. Yung luteal phase is from day 14 to day 28. Corpus luteum. So yung corpus luteum, this is now the remnants of the follicle. Remember guys, dito, 'di ba, yung nalabas ng ating egg cell during ovulation, anong nangyayari? Meron ng remnants na lang ang natitira sa ating follicle. So this remnant of follicle will serve as a temporary endocrine organ to produce estrogen and progesterone. But guys, remember, mainly progesterone. Mainly progesterone. So your luteal phase, your remnant of your follicle or your corpus luteum na tinatawag natin will secrete majority of your progesterone and some of your estrogen, and also it will produce inhibin. So later on we will discuss that. So tatlong hormone ang pinuproduce ng ating corpus luteum ha. Ano nga yung corpus luteum? Ito na yung naiwan sa ating follicle kasi nga lumabas na yung egg cell. So ang natitira is yung remnant. And this remnant or your corpus luteum will produce 3 hormones. Ano yung 3 hormones? Mainly progesterone, small amount of your estrogen, and your inhibin. So, increase estrogen and progesterone. Again, feedback mechanism. Kasi nga, mataas ng ating estrogen and progesterone, it will now suppress your FSH and LH. So, pag nasuppress ang FSH and LH, bababa na din ang ating, it will also cause suppression of your FSH and LH. So, if fertilization happens, your corpus luteum continues to produce your hormones for 8 to 12 weeks. So pag may fertilization na nangyari, your corpus luteum will still produce your hormones. Mas lalo niyang i-increase ang pagsikret ng progesterone. Magsisikret din siya ng estrogen. Tapos, Doc, paano Doc kung walang fertilization na nangyayari? Kung walang fertilization na nangyayari, your corpus luteum will atrophy. So, there will be atrophy of your corpus luteum. Bababa ang ating estrogen and your progesterone. Kasi nga, walang nangyaring fertilization, which leads to increased FSH, which starts a recruitment of follicle. In short, babalik na naman ang cycle sa umpisa. Your corpus luteum degenerates, a process called luteolysis. So, a process called luteolysis. So, ito yun. Tingnan natin. This is now your developing corpus luteum. And this is your corpus luteum. Pag may fertilization na mangyayari, magsisikret siya, continue na magsisikret siya ng ating progesterone, estrogen, and inhibin. Pero, pag walang nangyayari, your corpus luteum will atrophize, and then there will be decreased level of your estrogen and your progesterone. So, magdi-degenerate ang ating corpus luteum. Ang tawag dyan is now your corpus albicans. And then, since hindi na nagpo-produce ng estrogen and progesterone, there will be a negative feedback mechanism wherein tataas ulit ang gonadotropin-releasing hormone, magsisimula na naman ang ating cycle. So that's your luteal phase. Kaya tinawag na luteal phase kasi corpus luteum. Luteal phase, ang bida natin is your corpus luteum. So this is the basic cycle of your ovarian. This is your ovarian cycle. Review lang natin ha, yung pinaka-importanting points lang na gusto kong malaman nyo. Ovarian cycle, tatlong phases. Ano yung tatlong phases, Doc? Day 0 to day 14, we have your follicular phase. Follicular phase kasi nga ang nagsistimulate is your follicle stimulating hormone. Your follicle stimulating hormone will stimulate your follicles to mature. Tapos, this growing follicle will secrete estrogen. Anong next phase, Doc? Ovulation. Ovulation at day 14. Yung ovulation naman, kasi nga, marami ng estrogen na produce. An increased estrogen level at high dose of estrogen level, it will cause a positive feedback mechanism to your anterior pituitary gland to secrete LH hormone. And this LH will cause now your LH peak or LH surge. Kaya nagkakaroon ng ovulation. So yung ovulation will cause now the expulsion of your oocyte from your follicle. Then the expulsion of this oocyte is now we term as now your ovulation. Anong next sa ating ovulation na cycle? Next is your luteal phase. Ano po ang luteal phase, Doc? Doc, remember Doc, wala na po tayong oocyte or if fertilization takes place, ano nangyayari? Yung remnant na follicle, ang tawag natin dyan is your corpus luteum. Your corpus luteum will secrete majority progesterone. Some will produce estrogen. A minor will produce your estrogen and your inhibin. So if fertilization occurs, your corpus luteum will constantly produce your progesterone. Pero if walang fertilization na mangyayari, your corpus luteum undergo a process known as luteolysis. Maglalize ang ating corpus luteum, magiging corpus albicans. Pag naging corpus albicans ang ating corpus luteum, ano nangyayari? Hindi na magproduce ng hormone. Mababa ang progesterone, mababa ang estrogen. Therefore, the cycle will start again. Babalik na naman siya sa first cycle wherein dadamihin na naman niya ang follicle at saka yung LH. That's your ovarian cycle. Later on, we will discuss again your uterus. Now, we will proceed with your uterine cycle. Alam na natin yung ovaries. Ngayon, sa uterine cycle naman tayo. Yung ovarian cycle at your uterine cycle, they happen simultaneously. Kung anong nangyayari sa ovarian, kung may follicular phase sa ovarian, meron ding phase na nangyayari sa ating uterus. Tingnan natin. Your uterine cycle phases. So, ito yung nangyayari sa ating uterus. At day 0 to day 5, diyan nangyayari yung menstruation. At day 5 to day 14, diyan yun nangyayari yung proliferative phase. At day 14, di ba sa ovary, nagkakaroon ng ovulation. Tapos at day 14 to 28, nagkakaroon ng secretory phase ng ating uterine cycle. So may tatlong phases ng ating uterine cycle. Menses, and proliferative phase. And lastly, we have your secretory phase. Doc, kung i-compare po natin yung uterine cycle sa ating ovarian cycle, ano po ba yung mga equivalent cycle niya? So again, from day 0 to day 14, di ba, dyan nangyayari yung proliferative phase. So in short, your proliferative phase is equivalent to the follicular cycle of our ovarian cycle, while your secretory phase is equivalent to the luteal phase of our ovarian cycle. Later on, guys, i-combine na natin. Sa summary natin, guys, i-combine natin yung ovarian cycle, uterine cycle, yung FSH and LH para makita natin ang overview ng entire menstrual cycle, right? But right now, we will focus first with your uterine cycle. Again, day 0 to day 5, menstruation. Day 5 to day 14, proliferative phase. This proliferative and menses is equivalent to the follicular phase of your ovarian cycle. At day 14, may nangyayaring ovulation sa ating ovaries. Sa secretory phase, day 14 to day 28, this is equivalent to the luteal phase of your ovarian cycle. So first, let's review the anatomy of your uterus. Gusto kong uminom ng tubig pero wala akong tubig. Your uterus is composed of 3 layers. So along 3 layers ng ating uterus, we have your perimetrium, myometrium, and your endometrium. Check natin guys ha. Ito yung ating uterus. This is the fundus. Ito yung napapalpate namin sa tiyan. If buntis ang mama, napapalpate namin ang fundus. Tapos ito yung side niya. We have different layers. Perimetrium is dito, outermost layer. Then your myometrium, middle layer. And then your endometrium. Ito yung mucosal lining of the uterine cavity. This is the innermost layer. That's your endometrium. Next. Your endometrium has 2 important zones. We have your functional zone and your basal zone. Your functional zone, this is the layer closest to the cavity. Ito yung pinaka malapit sa ating uterine cavity or butas. Your basal zone is the layer just under your myometrium. So, your functional zone, layer closest to the cavity, this is the thicker portion. Tingnan nyo. Tingnan natin, functional zone, ito. Functional zone dito. This is the functional zone. Ito yung lumen. This is the thicker portion and it undergoes the changes with the monthly cycle. In short, guys, ito yung natatanggal during menstruation. Ito yung layer na nasa slough off during menstruation. While your basal layer is attached to the functional layer to the myometrium and it remains constant. So basal zone, ito yung zone na magpro-provide ng new layers ng ating functional zone. So yung functional zone, ito yung natatanggal, yung basal zone, ito yung remains constant. Remains constant. So again, balikan natin guys sa diagram na to. Ito yung endometrium, ito yung myometrium, ito yung perimetrium. So yung endometrium guys, remember, may dalawang layer. Ang outermost is your functional layer or functional zone. Then innermost layer is your basal zone. Ang basal ang magpro-provide ng new functional layer if mag-slough off ang ating functional zone. So yung functional zone is the one that is being sloughed off at nagkakaroon tayo ng menses. So guys, I have a story. Meron tayo akong story regarding your uterus. Naalala ko talaga, we have a interesting case presentation. Parang yung mga residents sa SPMC, they presented, each department will present a interesting case. So sa patho department, meron silang inintroduce na case, your uterine na case. So a patient came in na parang ang case niya or chief complaint niya is continuously bleeding. So kasi nga menstruation, so nagre-release lang siya ng kanyang menses continuously. So in short, nagbi-bleed ang pasyente. So it already how many days or what. So that was the case of the patho resident. So it is a competition from the different departments. So bawat department, surgery, IMOB, meron silang interesting case. So sa patho department, ang case nila is a 40 years old female patient na nagko-continuously bleeding. So nagbi-bleed lang siya, nagsaslough off lang kanyang menses. So it was Doc Esgana who presented the case. As in, super nice ang kanyang presentation, guys. So before niya na-introduce ang case niya, meron siyang iniwan na introduction sa amin. Before siya nag-start na nag-present, parang binigyan namin ng question na during a Miss Universe question, merong tinanong daw sa Miss Universe na what is the essence of being a woman? So that's how Doc Esgana presented the case. So my presentation siya, tinanong niya, what is the essence of being a woman? So usual na sagot is that simply to be able to bear a child. Tapos, diba, that's the usual answer. So curious kami na bakit ganun ang the way Doc presented the case na parang binigyan niya yung audience na parang question na bakit kaya ganun ang introduction niya na what is the essence of being a woman? And the essence of majority of women would answer that the essence of being a woman is really to bear a child. So that's the introduction. Ayan yung introduction ni Doc. And then he introduced the case na it's a case of a 45-year-old female patient na nagbi-bleed continuously for how many months na. So patient is very pale, as in super pale na siya. And then to find out sa history ng patient, ang patient said to be meron siyang 3 anak. 3 yung anak niya, tapos still nag-menstruate pa ng mami. So nasa reproductive age pa din yung mother. Tapos, so ang ginawa, pina-surgery ang pasyente, tinanggal yung uterus. Kasi nga, mamamatay ang ating patient pag hindi tinanggal yung uterus kasi nagko-continuously bleed ang pasyente. So ang ginawang procedure is your hysterectomy. Sa hysterectomy, tatanggalin itong uterus na to. Pag tinanggal na yung uterus na to, wala nang source ng bleeding. So that's the case. Tapos yung uterus is sinend sa patho department para i-examine. So para i-examine or malaman kung anong cause ng bleeding. So lo and behold, pag-check nila sa uterus ng patient, it was actually a case of your uterine didelphys. Ano yung uterine didelphys? Your uterine didelphys is a very rare condition. It's a congenital problem wherein your uterus forms, parang nagiging dalawa ang uterus. Tapos parang nagiging dalawa siya, and then dito, nagiging dalawa yung uterus, nasa-separate siya, and then nako-conjoin siya dito sa ating cervix. So parang nagiging ganyan yung forma na kanyang uterus. Pero the story was very amazing, guys. Kasi nga, sa history ng aming patient, sinabi niya na mayroon siyang 3 anak. And lo and behold, upon we provoking the patient, it was very impossible for the woman to bear a child. Kasi nga, it's a congenital problem and impossible na magkaroon siya ng anak. So with that, the mother was asked, "Ma'am, anak niyo pa ba talaga yung pasyente?" Kasi nako-confuse yung mga resident, kasi nga imposibleng magkaanak ang pasyente. Pero based sa history, mayroon siyang 3 anak. So when they try to ask the patient, inadmit ng patient na he never had a child, he never had the opportunity to bear a child, and he never disclosed the case sa kanyang mga anak. During that time, dyan yung sinabi niya sa mga bata niya or sa mga anak niya, siguro mga around teenager na yung mga anak, na she just adopted those children. And it was very, very overwhelming, guys. Promise. The way Doc presented the case, very amazing. And then, he ended the story with a quotation na it's not just, the essence of being a woman is not just able to bear a child, but rather to feel love and to be loved regardless of whether those are your children or not. So, as in, super amazed kami lahat how Doc presented the case. Parang standing ovation, and some really cried because ang sobrang ganda ng story. So, actually, Doc Esgana won the competition sa aming inter-hospital competition, and then it was actually presented sa Patho Society ata, and I'm sure panalo ata si Doc Esgana. It was a very, very interesting case. Sobrang ganda, guys, swear. So with that, let's continue. Tama na ang chismis, Doc. So let's continue. So your uterine cycle, let's start with your menstrual phase. Your menstrual phase, let's start again with your menstrual phase. Day 0, okay, guys, day 0 ito ha. Day 0 or day 1 to 5. Menstrual phase. So menstrual phase, a lack of signal from a fertilized egg influences in the drop in your estrogen and your progesterone. Remember, in your ovarian cycle, ano nga nangyayari? During your luteal phase, pag walang fertilization na nagaganap, bumababa ang estrogen and your progesterone. So with that, it has also an effect to your uterus. Anong nangyayari? Nagkakaroon ng mababang estrogen and progesterone, therefore, nagkakaroon ng sloughing off of the thick endometrial lining, which is the menstrual flow. So there will be a drop of progesterone. Pag mababa ang progesterone, nagsaslough off ang ating endometrial lining, which now cause your menstrual flow. So this occurs approximately 3 to 5 days. So tatandaan natin, guys, yung menstrual phase, siguro around 3 to 5 days. So your menstruation, your menstrual cycle is approximately 25 to 35 days with an average of 28 days. So this is your menstrual cycle, approximately 28 days. Menopausal age Menopausal age is around 45 to 55 years old with an average of 53 years old. Menstruation lasting around 3 to 5 days, and the average blood loss is around 50 ml. So depending on the person, may ibang person na around 50 to 75 ml per blood loss. So uterine cycle now for day 6 to 14. Day 6 to 14 na tayo, or day 7 to 14. Anong nangyayari? This is now your proliferative phase. It is stimulated by estrogen. Thickens your endometrium. Naalala nyo, guys, yung sa follicular phase? Yung follicular phase sa ovary, di ba? Nag-grow yung follicles. And with the growing follicles, nagkakaroon ng increase ng estrogen. So ito na yung estrogen. Anong trabaho ni estrogen? Ang trabaho ni estrogen is to thicken your endometrium. Ito, tinithicken na yung endometrium. So your uterus, there will be proliferation of your cells, basal stroma, and your epithelial cells on the uterus. Tingnan nyo, kumakapal na ating uterus. So that's the function of your estrogen. Next, day 15 to 28, last day na. This is the last cycle, secretory phase. Your secretory phase is stimulated by your progesterone. Remember again your progesterone, anong equivalent ng secretory phase ng ating uterine cycle sa ating ovarian cycle? It is your luteal phase. And anong sinisikret ng luteal phase? It is your mainly progesterone. So anong trabaho ng ating progesterone? Your progesterone endometrium becomes receptive for implantation. It maintains and stabilizes the lining. So your progesterone will maintain and stabilize the lining. Diba ito yung pinapaalala ko sa iyo na function ng estrogen and progesterone. Estrogen, pinapakapal sa proliferative. Progesterone, mini-maintain and stabilize ang ating uterus. Kasi nga, ini-increase ang vascularization and for the formation of zona compacta and spona spongiosa. Kasi nga, sa secretory phase, nag-expect ka na magkaroon ng baby or possible implantation if there will be fertilization. So in short, mini-maintain mo for the possible fertilization. Eh kung walang fertilization, anong mangyayari? Remember your corpus luteum? Nagiging corpus albicans, bumababa ang hormone, ang estrogen and progesterone. With that, there will be menstrual cycle. So in short, bumabalik na naman tayo sa menstrual flow. So let's give an overview of our uterine cycle again. Day 1 to 5, siguro merong menstrual phase. Menstrual phase, menstruation sloughing off because walang stimulation ng estrogen progesterone. Next, anong next is your proliferative phase. Your proliferative phase is by the action of your estrogen. Pinapakapal ang ating uterus. Wait lang guys, may tumatawag si Doc. Ipopause ko lang. Wait lang. So I'm very sorry for that introduction. So my consultant asked me about my patient. Bigla akong kinabahan. Buti na lang ayos. So to continue, sana pa tayo? Wait lang guys. Check ko lang ang ating setup. Okay na, nag-record na siya. Okay. Hello. So let's continue. So this is now the overview of our uterine cycle. First, we have your proliferative phase, which is stimulated by your estrogen to rebuild your endometrium. So parang pinapakapal ang ating uterus. Secretory phase, stimulated by your progesterone, which prepares for possible implantation. Lastly, we have your menstrual phase. Ano nangyayari sa menstrual phase? There will be lack of estrogen and progesterone. That's why your function zone or functional zone will be sloughed off. So that's gonna be your menses. So Doc, paano naman po if fertilization happens? So if the egg cell is fertilized, remember saan napupunta yung pag there is expulsion of your oocyte from your follicle, di ba remember, kunan siya ng membrane at saka pupunta siya sa ating ampulla. So if the egg cell is fertilized, the embryo produces an HCG. HCG signals your corpus luteum to continue to supply your progesterone to maintain the uterine lining. So in short, meron na tayong embryo dito. Yung embryo mo dito, magsisecrete ng HCG. And this HCG will stimulate your corpus luteum to maintain or will stimulate your corpus luteum na dapat i-maintain niya ang kanyang production ng progesterone. Then the progesterone will maintain your endometrial lining and thickens your cervix so that there will be okay ang environment for the baby to grow. Again, let's review Your hypothalamus will secrete your GnRH to your anterior pituitary. Then, it will stimulate your Let's just focus on the fertilization part nila kasi paulit-ulit na lang tayo. So again, your placenta, your embryo that has your placenta will produce your HCG, which will stimulate your corpus luteum to continuously produce mainly progesterone and some of your estrogen, because these are essential for your uterine lining, but mainly your progesterone. With that, I will just insert na lang yung placental hormone since na-fertilize naman natin yung pasyente natin. So, i-insert ko na lang yung placental na discussion. Pero hindi pa tayo tapos sa ating female gonads. I'll just insert the placental parts. Kasi nga, na-discuss naman din natin yung placenta. So, your placenta, so, di ba, it happens here. So, pag merong nangyayaring fertilization, pag fertilization happens, anong nangyayari? It will become a zygote, tapos nagiging 2-stage cell, nagiging 4-stage cell, hanggang nagiging morula. And this morula, magta-transform siya into a blastocyst. Your blastocyst will enter now your uterus. Kasi nga ito is your fallopian tube pa lang naman. But your blastocyst will enter your uterus. Anong nangyayari dito, Doc? Your blastocyst will be converted into two parts. Magfo-form siya ng embryoblast at magfo-form siya ng trophoblast. Ang trophoblast is dalawa, cytotrophoblast and syncytial trophoblast. And this cytotrophoblast and syncytial trophoblast is the fetal placental component of your placenta. Fetal part of your placenta. Actually, ang gusto ko lang malaman yun, not this one, but these two, your cytotrophoblast and syncytial trophoblast, is the component of your placenta. Fetal component of your placenta. Cytotrophoblast, syncytial trophoblast. Yan lang gusto kong malaman nyo. Kasi nga, so, pag 2 months years old ng pasyente, ang baby, ang fetus, tingnan natin, yung embryo natin, nakatouch sa ating umbilical cord patungo sa ating placenta. Ito na yung placenta, ito yung umbilical cord, and ito na yung ating placenta. The chorion or the fetal portion of the placenta. Diba? Fetal part na placenta, anong sinasabi ko? Meron siyang dalawang types ng trophoblast. Ano yon? Cytotrophoblast and your syncytial trophoblast, which comprise your chorionic villus. So, within your chorionic villus, nandyan yung syncytial trophoblast and cytotrophoblast. That's the fetal portion of your placenta. So, what is the function of your placenta? The function of your placenta, it is for implantation, nutrient and gas exchange, as well as for fetal protection from any immunologic attack, and prepare environment for your pregnancy. Pero the most important function of your placenta is really your nutrient and gas exchange. You know what, guys? Maraming disorders na pwede nating i-correlate sa ating placenta. But for our discussion, I will not discuss those things kasi nga medyo medically inclined na siya towards OB-GYN. So if you want to proceed into medicine, you will really discuss more of the placental disorders. Tingnan nyo guys, ito yung dinideliver namin. When we do delivery of our babies, dalawang delivery ang nangyayari. Delivery of the child or the infant or the baby, delivery of the baby. After that delivery of the baby, kailangan i-deliver ang placenta. So this is the fetal part of your placenta and this is the maternal side of your placenta. Doc, bakit kailangan yung i-deliver after the delivery of the baby? Because duduguin ang pasyente if hindi natin matanggal ang ating placenta. There will be continuous bleeding. Kahit mag-retain ka lang ng konti or may naiwan na konting placenta dyan, you know what? It can cause severe bleeding to patient and the patient may undergo a shock. Magkakaroon ng shock ang pasyente at mamamatay ang pasyente. That's why we have to get this placenta. Meron time na may naiwan na konting part ng placenta, hindi namin na deliver yung placenta ng maayos. So what we do is, nilagay lang ni Doc yung kamay niya, kinuha niya as hand. Pagtingin ko, very painful shit. Pero pinasok ni Doc at tinay niya na scrape. Pero meron tayong mga instrument na ginagamit. Pero for a time na mga emergency cases na talaga na kailangan tanggalin, gamit kamay, pasok. Tapos siniscrape, tanggalin ang placenta. Kasi nga, napakadelikado pag naiwan yung ating placenta. Marami tayong mga disorder. Kung curious kayo, meron tayong placenta previa. Ano yung placenta previa? Delivery, yung placenta is nasa cervix, nasa ilalim na ng cervix, di ba? Ito yung cervix natin. Then during delivery, yung placenta is napunta dito. So, hindi natin madideliver ang baby. Ang unang madideliver is placenta, and that's gonna be delikado para sa ating baby. Baby might have a decreased level of oxygen and also will die. So with that, if may mga placenta previa, so ginagawa namin, patient may undergo CS section. So I know you're curious about that. Marami pa yung mga disorders na yan, pero it's a bit technical on our part, on your part. So if you go to medicine, you will be discuss this in an OBGYN na topic. Very interesting. Maraming cases na interesting sa OBGYN. So what are the placental hormones that is produced by your placenta? It is your HCG. Your placenta can also produce estrogen and progesterone, as well as relaxin and your human placental lactogen. Majority of these placental hormones is actually produced by your anong trophoblast? It is your in situ trophoblast. Again, majority of this hormone, your HCG, estrogen, progesterone, relaxin, and HPL is actually secreted by your in situ trophoblast. So your human gonadotropin, again, stimulates your CL to continue the production of your progesterone and estrogen to maintain your pregnancy. Your estrogen and progesterone maintain pregnancy. The placenta produces sufficient estrogen and progesterone from your maternal and fetal precursors to take over the function of your corpus luteum. If ever after 6 weeks of pregnancy, di ba, namamatay na din ang corpus luteum. So ano ang mag-maintain ng ating estrogen and progesterone? It is now your placenta. How about your relaxin, doc? Your relaxin maintains your pregnancy, inhibiting myometrial contraction. So, nire-relax ang uterus. Human placental lactogen, ang purpose niya is to decrease your insulin sensitivity and decrease utilization of your glucose, thereby making larger quantities of glucose available for the fetus. So that maraming glucose na pumupunta or pumapasok sa ating baby. I guess this is now the summary of the entire discussion of our menstrual cycle. Kaya natin to, guys. Diba? I tried my best to simplify everything, pero ngayon, i-combine na natin yung ovarian cycle, yung uterine cycle, pati yung mga action ng different hormones. So, kaya natin to, guys. Let's start with your hormones. At day 0, ano nga yung day 0? Diba? Menstruation. Yung day 0 nga, ano nangyari? Mababa lahat ang ating hormones. Mababa ang ating luteinizing hormone, mababa ang ating follicle stimulating hormones. So hormone muna tayo mag-focus, guys. Tingnan nyo, guys, yung color green na ito is your FSH. Yung kulay na blue is your luteinizing hormone. So focus muna tayo sa anterior pituitary hormone. I guess mas dapat nating unahin yung ang tawag nito, yung hypothalamic hormone. So nag-drawing na ako kasi hindi siya na-include. Let's just draw this red part here. Itong ay red ba or orange? This orange part, just remember, this is your gonadotropin releasing hormone. Itong orange na part is your gonadotropin releasing hormone. Yung green, yung FSH, yung blue, yung LH. So yung anterior pituitary and your gonadotropin releasing hormone. Diba? At day 0, mababa lahat ang hormone. Mababa ang lahat ng hormone. Anong nangyayari? Pag mababa ang hormone, ang estrogen and progesterone, ano ang negative feedback? Siyempre, tataasan mo ang gonadotropin releasing hormone. Mas stimulate ang gonadotropin releasing hormone. So there will be constant increase of our gonadotropin releasing hormone from day 0 until day 14. Tataas constantly ang ating gonadotropin releasing hormone. Pag mataas ang ating gonadotropin releasing hormone, anong nangyayari? Anong nangyayari? It will also cause the release of your LH and your FSH. So, tataas ang ating FSH, itong color green, tingnan nyo, pataas ng pataas ng pataas. Pero, ano napapansin natin, guys? There is just a constant increase of your LH unlike your FSH. Mas mataas yung FSH. So, yung FSH natin, tatandaan natin, ano nga ang function ng ating FSH? Your FSH will cause the stimulation of your follicle, of your growing follicle. So ito yung ovarian cycle. Now, meron na tayong FSH. Papasok na tayo sa ating ovarian cycle. Si FSH pupunta sa ating ovaries. Tingnan nyo sa ovaries, si-stimulate niya ang growing follicle. Pag na-stimulate na yung growing follicle, anong nangyayari guys? There will be production of your, ano pinuproduce ni growing follicle? Estrogen. So, tataas ang ating estrogen. Tingnan nyo yung estrogen. Pataas din ang ating estrogen. Di ba? Nag-make sense na, nako-correlate na natin. So, tumataas din ang ating estrogen because of the stimulation of your FSH to your follicle. So, what happens next? Dahil tumataas ang ating estrogen, kita nyo, pataas ng FSH, pero bakit, Doc, bumababa ang lutein? Bakit hindi masyadong tumataas? Parang nag-plateau sa low dose ng LH lamang ang ating anterior pituitary. Kasi nga, at a low dose of estrogen, ditong part guys sa estrogen, kulay orange, low dose, remember this, at a low dose of estrogen, it will inhibit the release of your luteinizing hormone. I repeat, at a low dose of estrogen, tingnan nyo dito, kahit na paakyat siya, it is still considered as a low dose. So a low dose of your estrogen, it will cause a inhibition of your luteinizing hormone. Tingnan nyo, constant low ang ating level ng LH. Pero at one day before ovulation, anong napapansin natin? There is already a peak of your estrogen, di ba? One day, 13th day, one day before ovulation, there is a peak of your estrogen. Anong nangyayari if there is a peak of estrogen? At a high dose of estrogen, it will cause a positive feedback to your anterior pituitary hormone to secrete luteinizing hormone. So there will be increase or surge of your LH. I repeat, at a high dose of estrogen, pag peak ng estrogen dito, there will be a stimulation or a positive feedback to your anterior pituitary hormone to secrete your luteinizing hormone. That's why there is LH surge. Right? So remember ha, dalawang ginagawa ng estrogen. At a low dose estrogen, in-inhibit niya yung LH, kaya siya mababa dito. Pero at a high dose of estrogen, pag peak ni estrogen, it will now stimulate your anterior pituitary to release your LH. That's why there is LH surge. Doc, question, how about your FSH, do? Kanina, there is a constant increase ng FSH kasi nga wala namang nag-inhibit sa FSH, right? So paakyat. Pero Doc, napapansin ko parang bumaba siya dito one day prior sa ovulation. Pag-increase ni estrogen one day prior to the ovulation, bumababa din yung color green, yung FSH, one day prior to ovulation. Anong reason dyan? The reason kung bakit bumababa ang FSH one day prior to ovulation is to make sure that only one follicle will mature. Again, the reason bakit bumababa bigla one day prior to ovulation is to make sure that only one ovary ay one follicle will mature. So isang oocyte lang ang lalabas. Okay, very good. So nakita na natin, paakyat. Tapos pag mataas ng ating estrogen, it will stimulate now your LH surge. Anong nangyayari pag merong LH surge? There will be ovulation. Anong nangyayari sa ovulation? Lumalabas ang ating egg cell. Nagiging mature, pupunta siya sa ating fallopian tube and will wait for its reproductive destiny, which is your sperm cell. So, if after that, the remnant of your follicle will become your corpus luteum. Doc, anong nangyayari sa corpus luteum natin, Doc? Your corpus luteum will secrete now your progesterone. So, ang bida sa ating follicular phase is your estrogen. Ang bida sa ating luteal phase, it's your progesterone. Kasi nga, corpus luteum will secrete your progesterone. Mataas. Pero may pinuproduce din siyang konting estrogen. So Doc, bakit kailangan pataasin ang progesterone na sinisikret ni corpus luteum? Because your progesterone will maintain the thickness of your your uterine cycle for possible implantation. I repeat, your progesterone is essential to stabilize, to maintain the thickness of your uterus. Kasi nga, ang trabaho ni estradiol sa ating proliferative phase, papakapalin. Ang trabaho ni progesterone sa ating lutea, sa ating secretory phase, papakapalin for possible implantation. Pero sad to say, walang nangyaring fertilization. Ang mangyayari, your corpus luteum will decrease. Bababa si corpus luteum, mag-degenerate si corpus luteum hanggang magiging corpus albicans. So pag mababa ang ating corpus albicans, anong nangyayari? Bumababa ang ating progesterone, bumababa ang ating estrogen. Tapos since wala ng progesterone and estrogen, nagkakaroon na tayo ng menstrual cycle. The cycle will start all over again. The cycle will start as slow hormone sa ating anterior pituitary, low hormone sa ovarian, and low hormone sa ating gonadotropin releasing hormone. The cycle will start all over again. I hope you understand the entire menstrual cycle. This is it, guys. Ito yung ovarian cycle, anterior pituitary, ovarian, and your uterine cycle. So just remember anong mga equivalent na phases sa pag-ovarian, follicular, anong equivalent na sa uterine? It's your proliferative and menstruation. Pag luteal phase, anong equivalent sa uterine? It is now your secretory phase. So I guess that's it. I know you already understand bakit biglang mag-peak, bumababa, tapos increase and decrease. That's how we discuss your menstrual cycle. If you have any question, guys, please do not hesitate to ask me. I'm really interested to know na if you really understand this one or you really don't understand this one, because I am more than willing to help you out. I'll try, as in, ginawa ko ang best ko para maintindihan yung menstrual. Pati man ako, guys, ayaw ko ng menstrual cycle kasi nga napaka-complicated. Once makita ng ganito ng student, nawawalan ng gana. So just PM me anytime. Just tell me if you understand or you don't understand. So for the HPO axis, you always go back. Ito talaga ang basic, guys, ha. Ito talaga yung pinaka-basic. Pag mababa na si estrogen and progesterone, tataasin si GnRH, then si FSH and LH, then tataas ulit si estrogen and progesterone, babalik ulit sa negative feedback mechanism. It was a wrap. Ang daming diniscuss natin. For now, let's proceed with the different disorders of your female gonad. Di pa tayo tapos. Grabe naman to. So, your disorder, we have your amenorrhea, absence of menses. So, there is an absence of menses. We have a primary amenorrhea. Pag sinabi natin primary amenorrhea, when woman has never menstruated. So, never siyang nag-menstruate. While your secondary amenorrhea, who has had at least one menstrual cycle followed by the absence of menses for a minimum of 3 to 6 months. Meaning, ang secondary, nagkaroon na siya ng menstrual cycle, pero huminto for a minimum of 6 months. That's a secondary amenorrhea. Primary, never talaga siya nagkaroon ng menstruation. Oligomenorrhea, infrequent or irregular menstrual bleeding with cycle lengths in excess of 35 to 40 days. We have also your menorrhagia. This is already uterine bleeding which is in excess of 7 days. So this is how we approach our patients with primary amenorrhea or secondary amenorrhea. So in order for us to give to identify the possible differential diagnosis for our patient, this is the best way for us to know whether the patient has this certain condition, just knowing the breast development and uterine development. We don't have to check for test natin ang FSH, test natin LS, test natin estrogen. No, we don't do that. By just knowing the clinical features of our patient, we will already narrow down our differential diagnosis. Paano po ba yan, Doc? First, breast and uterus. Titingnan lang namin sa aming pasyente. Breast, wala siyang breast. Pag walang breast, you have already the idea that the ovary does not secrete your hormone, right? Kasi nga, anong hormone ang nagsisecrete? Anong hormone ang importante for the breast development? Estrogen, progesterone. It is your estrogen. That is why if you have breast problem, you go back again. So most probably, there is a problem of your ovaries. Next, uterus. Merong uterus pero ang problema, meron siyang uterus pero ang presentation lang ng patient is wala siyang breast. So what are the possible problem? Pwedeng meron tayong hypothalamic failure, merong pituitary failure, or merong gonadal failure. Example ng hypothalamic failure. So, walang breast ang patient, meaning hindi siya nagsisecrete ng estrogen. So, hypothalamic failure. Pag may problema ang ating hypothalamus, nagsisecrete pa tayo ng GnRH? Hindi. Kasi nga, may hypothalamic failure. Therefore, mababa ang FSH and LH. Therefore, hindi na-stimulate ang ating ovary. In short, mababa ang estrogen. That is why meron tayong underdeveloped breast. Okay, gets? How about pituitary? May pituitary problem. Because may pituitary problem, you will not be able to secrete your FSH and LH. Kahit nga normal ang hypothalamus mo, kahit nakakasekrete ka ng gonadotropin releasing hormone, remember, may problem ang pituitary mo. In short, there will still be low level of your LH and FSH. In return, mababa pa rin ang ating estrogen level. Kaya, patient will manifest with underdeveloped breast. Pwede pa rin. How about gonadal failure, doc? Your gonadal failure, ang problema ang gonads. Bakit? Pereng may problema sa gonads genetically na hindi siya na-produce ng ovaries. So ano nangyayari? Mababa ang hormone, mababa ang estrogen and progesterone. Kahit na mataas ang GnRH mo kasi nagne-negative feedback ka, kahit mataas ang ang FSH and LH, hindi pa rin ikaw makakaproduce ng estrogen kasi nga may problema sa iyong gonads. Therefore, mababa ang estrogen, your breast will be still underdeveloped. Diba? With that kind of idea, we already narrow down our problem. Next scenario, meron siyang breast, wala siyang uterus. So, anong mga possible causes? Androgen resistance or uterovaginal agenesis. Unahin natin itong uterovaginal agenesis. It's just a problem wherein hindi ka nag-form ng uterus and your vagina. So there is a blind pouch of your vagina. So walang uterus and kulang yung vagina. So in short, walang uterus. So since walang uterus, hindi ka mini-menstruate. So this is a primary amenorrhea. How about androgen resistance? Later on, when we reach the discussion in the male gonads, we will encounter again your androgen resistance. So ano yung androgen resistance dito, doc? Yung androgen resistance or your testicular feminization, you are actually male, you have the testis, however, you have a testis, doc, you have a testis, pero bakit ka po bakit po merong na-form na estrogen and there will be developing of your breast? Kasi nga, kahit na meron kang testis dito, ang nangyayari is that you have androgen resistance, meaning you have testosterone level, pero your body does not react to your testosterone. Resistant ang katawan mo sa testosterone. So, anong ginagawa ng katawan natin? Yung testosterone is kino-convert into estrogen. That is why tumataas ang estrogen level, nagkakaroon ng breast development. So, this is how we explain. Lastly, walang uterus, walang breast. These are the possible enzymes. Pwedeng may mga enzyme deficiency that leads to the underdevelopment of this one. Doc, how about, doc, merong uterus, merong breast, merong uterus, ano? So in short, the patient had normal estrogen level. It is just a secondary amenorrhea. Paari pa rin may problema sa hypothalamus, pituitary, ovary, and your uterus. So this is already a secondary amenorrhea, meaning it is not a congenital. Rather, may menses ng pasyente natin, nagka-mens na siya, pero huminto for certain conditions. So maraming conditions yan. But for this part, ang gusto ko lang malaman nyo is this one. Ito talagang pinaka-importante for me. You know na walang breast, pero may uterus, there's hypothalamic failure, pituitary failure, and gonadal failure. This failure is subdivided into whether it is hypo or hypergonadotropic, hypo or hypergonadism. Sige, balikan natin ang hypothalamus, pituitary, gonad system. Kaya balikan natin ha. Merong breast, merong uterus and ovaries, hypothalamic failure. Hindi siya nag-produce ng GnRH. So kung hindi siya nag-produce ng GnRH, mababa ang LH, FSH, mababa din ang kanyang ovarian hormone. So, do you think, is it a hypo or hypergonadotropic? Pag sinabi natin gonadotropic, this refers to the hormones produced by your hypothalamus and your pituitary gland. So, question, hypothalamic failure, hypo or hyper? Hypogonadotropic or hypergonadotropic? Please answer. Try to answer para you can assess yourself. Hypo or hyper? Hypothalamic failure. Of course, hypo kasi nga walang naproproduce. Hypogonadotropic. Hypo or hypergonadism? Ang hyper or hypergonadism, this refers to the ovarian hormone na pinuproduce. So, in a hypothalamic failure, hypo or hypergonadism? It is hypo kasi nga walang GnRH, walang magsistimulate sa FSH and LH. So in short, ang FSH and LH will not stimulate your ovaries. So mababa ang gonadal hormone. So let's proceed with pituitary. Mababa ang may sira ang pituitary, kahit normal ang hypothalamus, mababa ang FSH and LH. Is it hypo or hypergonadotropic? Hypo or still hypogonadotropic kasi nga yung gonadotropic refers to the hormones produced by the hypothalamus and pituitary. Sira ang pituitary, hindi siya makaka-produce. So hypogonadotropic. Pero ano nangyayari sa ating gonadism? Is it hypo or hyper? It is still hypo. Wala ka nang FSH-LH, therefore your ovaries will not be stimulated. Last, gonadal failure. Ang may sira is your gonads, pero your hypothalamus and pituitary is normally producing their hormones. So is it hypo or hypergonadotropic? This is hyper na. Kasi nga, may problema sa gonads, mababa ang ating gonadal hormone. As a negative feedback, tataasan ang ating GnRH, tataasan ang ating FSH-LH, therefore hypergonadotropic. So ang gonadal failure, it's gonna be hypogonadism. Yan guys, I know you understand this one. Balik lang tayo sa ating HPG axis. So now let's classify the different disorder. Ito na yung mga disorders na sinasabi ko guys. We have your hypogonadotropic hypogonadism. Alam na natin to, guess na natin to. So ano mga possible problem? Weight loss. So if you have anorexia nervosa, there will be disruption of your GnRH secretion. So mababa ang GnRH, bababa din ang FSH-LH, mababa din ang ating gonadal hormone. Intense physical exercise, your runner's amenorrhea, your pituitary tumor and your prolactinoma, these can cause a decreased level of your sex hormone. Therefore, there will also be hypogonadotropic hypogonadism. We have also your hypergonadotropic hypogonadism. Again, menopause. 45 to 55 years old, if you are already in a menopausal age, ano nangyayari? Mataas pa ba ang ating estrogen and progesterone? Mababa na. Since mababa ang ating estrogen and progesterone, there will be hypogonadism. So what will be the negative feedback mechanism? Balikan natin dito. Mababa ang ating estrogen and progesterone. Negative feedback mechanism, tataasan ang GnRH, tataasan ang FSH and LH. Therefore, there will be hypergonadotropic. Still, your ovaries na nasa menopausal age, it will not react to the increased level of your gonadotropic hormones. Gets? How about Turner syndrome? Sa Turner syndrome, ganun pa din. May egg cells die prematurely, occurs when your ovaries which stores and release eggs stop working before the age of 40. In short, your eggs die prematurely. Ganun pa din. Ang problema, ang ovary. Mababa ang estrogen progesterone, HPO axis, tataas ang GnRH, tataas ang FSH-LH, pero hindi masistimulate ang ovary. That's why hypergonadotropic hypogonadism. And lastly, we have your, last talaga guys, we have your polycystic ovary syndrome. It is an irregular period, increased androgen, and polycystic ovaries. Still, you have underdeveloped follicles. Your follicles does not develop and unable to release an egg. So the problem is still within your ovaries. In order for you to understand these different clinical problems, you always go back to the HPO axis. Pag alam mo talaga to guys, hindi ka mawawala kung hypergonadotropic pa to, hypogonadism. So, expect in my quiz, maraming mga tanong about, is it hypergonadotropic or hypogonadism? Pero I know, naiintindihan niyo naman tong HPO axis. So, this is your Turner syndrome. So, Turner syndrome, ito yung sinasabi natin sa Turner syndrome. or your premature ovarian failure. So usually this is a monosomy X, so X0 ang presentation niya, chromosome on a 23 paired. So usually they have a short stature, low hairline, widely spaced nipple, and shorted metacarpal. So I have a patient na may Turner syndrome, pero kasi pag may mga chromosomal problem, the only way to confirm certain syndrome or diagnosis is to really do a genetic testing. So our diagnosis is only a presumption based on the clinical feature of our patient. So may patient ako na Turner syndrome, ang pinaka-prominent feature talaga ng Turner syndrome is may web neck siya, guys. So it was very memorable sa akin yung patient na may Turner syndrome kasi nga it was my first mortality na patient during my clerkship time, and I was really attached sa patient and I was really close to the mother. I mean, I monitor the patient. The problem with the patient is that when you have Turner syndrome, you will have different organ problem, different organ anomaly, tapos ang pasyente will have a recurrent pneumonia. So ang pasyente ko, nagkaroon siya ng recurrent pneumonia, lagi siya nagkakaroon ng pickup C, severe type of pneumonia. Then all of the sudden, my patient underwent petit mal seizure. Pag sinabing petit mal seizure, it's an absence type of seizure. Yung nagsi-seizure na wala kang nakikitang manifestation. Di ba usually, pag nagsi-seizure, nakikita to, gumagalaw ang pasyente, tapos there will be upward rolling of the eyes. Pag petit mal seizure, nakaupo lang ang pasyente, tapos blank stare, the patient underwent already a seizure. It's kahit hindi mo nakita physically, but internally sa brain nagkakaroon ng seizure ang patient. And the patient died actually. They tried to revive the patient. However, since it's a Turner syndrome, pag intubate nila na patient, maraming anomaly, nahihirapan silang mag-detect, mag-locate kung saan ang trachea, kasi nga, it's a combination of anomaly. So, it was very, sobrang sakit kasi nga, pagbalik ko sa hospital, it happens kasi during my off hours. So, pagbalik ko sa hospital, shock na lang ako, nakita ko yung mother, bigla niya lang akong hinag. And then, pag-hug ng mother, bigla na siyang umiyak and explained to me na the patient died. It was very painful. I really cared for my patient. Parang sobrang memorable. Memorable in a negative way, no? Pero hindi talaga. For me, no, in terms of mortality, ayoko talaga makakita ng mga bata. Kasi nga, they're still innocent and parang sayang life. Pero we're not God. We cannot control the lives of our patient. But I know that we did our part to save our patient. Actually, we still do not know what happened to our patient, kung anong cause na why patient underwent um, petit mal seizure or cardiopulmonary arrest. So, actually, ang family ayaw nila ipa-autopsy ang patient, but the resident asked me na to try, kasi nga medyo close na ako sa mother, and then I asked the mother na, ma'am, pwede natin ipa-autopsy para at least may closure and malaman natin kung ano nangyayari sa pasyente, and this will also help us na become a better physician to our future patients. So, pumayag ang mother. Yes, sobrang tagal, hindi pa na-release yung autopsy result. Until now, I don't know what already happened. Sobrang tagal. Kasi nga, once in a government institution, sobrang tagal. Once hindi siya masyadong mga crime scene na mga autopsy, masyadong matagal ang releasing ng result. So with that ends our discussion for your female gonad system. We will continue. Magla-lunch lang muna ako. Thank you, everyone.